Hello friends, now you are watching this video. That means you have already gone through your hair transplant and you are here to know about post-procedural, post-hair transplant instructions. So let's know about how your graft can get damaged and how you can prevent them. Hello friends, myself Dr. Nipun Kesarkar. I'm a dermatologist, cosmetologist and hair transplant surgeon from Hairfree Hairgrow Clinic. Now that your transplant is done, let's know about what can damage your hair grafts and how you can prevent them. So first thing about your hair transplant is your transplanted hair might get dried up, and because of that your hair grafts might get damaged or destroyed. So what causes the drying of graft is first sunlight, air blows that might came out the fan or AC, which can cause the dryness of the graft and resulting in damaging them. So what you can do to prevent them? There is a RL saline spray which normally your doctor will provide you. It might contain ringer lactate saline or hypothermosol solutions. This spray you need to spray every hourly on your implanted region so that your graft can survive. Like every small tree, when we plant it, we need to water them. Like that, you need to spray this graft every time to time. Secondly, you should not touch your implanted or donor area. Because of touching, you might get infection in your donor or implanted area. Third point, sitting position. Whenever you are going to sit, you should not lean forward, but you recline back so that the tumescent anesthesia which is given inside your donor area will not come on your forehead. That will really increase the swelling on your forehead, periorbital region, nose and cheeks. So sit in a reclined position. After that, dust prevention. Whenever you are sitting outside or inside your home, there will be dust which will accumulate on your implanted area and can cause infection. To prevent from dust, the surgical cap will be provided by your doctor to put on your implanted and donor area so that the dust won't go inside, the sunlight will not be penetrate this area and your graft will be protected. So whenever you are using the cap, you should wear it from front to backward, and when you are going to remove it from backward to front. That will prevent the graft from touching the cap so that the graft will not be damaged. After that, one more thing you need to know is you should not take head bath for at least 4 to 5 days after hair transplant. Let the transplanted graft settle inside the skin, and after that you can start your head wash. So this was about the implanted area care. Now we are going to know about how to take care of your donor area. There are very small, about 1 millimeter sponge hole present on your donor area because of the extraction of graft. So these wounds you need to clean every day. On the day of surgery, the doctor will put a bandage on your donor area, and those bandage you are going to remove on the very next day of the surgery. For cleaning process, there will be betadine solution. Betadine is a povidone iodine which will cleanse the donor area properly. While cleaning, you need to use gentle pressure to remove the previously applied cream, and every time after cleaning you need to apply new cream on your donor area. These cream are antibiotic cream which will prevent from infection. So the donor area care is cleaning and applying antibiotic cream twice daily, in the morning and evening. It will help preventing from infection and increase the healing speed. After that, there are some medications that you need to take. One is to prevent infection. If there is an infection, the graft will get damaged and the hair transplant result will get hampered. So we need the antibiotics for about 5 to 7 days. After that, we need painkillers. Once the anesthesia given during the hair transplant, its effect will reduce, the pain might occur. So we need painkillers for that purpose. After that, we need anti-inflammatory or swelling medication to reduce the swelling which came in 80% of patient over forehead, nose and periorbital region. So this swelling is because of the fluid which we give during the surgery. After that, we need antacid which will reduce the acidity problem because of all these medicines. So these are the medications you need to take after hair transplant for 5 to 7 days according to your day of surgery or according to your condition. After this, we are going to know about first head wash. The first head wash will be done after 6th or 7th day of hair transplant. After hair transplant, there will be some crust which are present on your implanted area. So these crusts are generally made up of dried up skin which came with the extracted graft and are dried up and become crust. So these crust we need to soften up before removing them. So we need very slow running water to pour over this implanted area so that the graft will get wet. After that, we need shaving foam which we are going to apply on implanted area in the direction of implantation. So if you think that you can remove this in 4 to 5 washes with this gentle pressure, if it is possible to remove this crust with gentle pressure in 4 to 5 washes, do it once daily. Or if you see that this crust cannot be removed with one wash in a day, then you can also do the head wash twice daily. So after this implanted area, the donor area can be washed with any betaine based baby shampoos so that the donor area will get cleaned up. After hair transplant, there are some important instructions like you should not do exercise. Exercise in early phases will increase your blood pressure, because of which the peripheral blood vessels will get dilated, the pressure of blood will increases and the graft might get pushed out of your scalp. The second thing about exercise will cause sweating. Because of sweating, there might be a chance of infection which will increase in about 10-fold. After exercise, you should avoid any addictions like smoking, alcohol. You should not apply hair dyes, hair colors, hair dryers. Also, you should not apply any oil if it is not advised by your doctor. After that, you should avoid trimming after hair transplant for at least 1 month. So all these instructions you need to take care of so that the transplanted hairs won't get damaged. So what are the medications you should continue after hair transplant for longer duration? There are some medications like biotin, vitamin supplements, vitamin D3, the finasteride or dutasteride medicines to reduce the speed of baldness or to reduce the progression of disease. After that, last but not the least, minoxidil you need to apply to preserve your existing hairs and 20% of your those transplanted hairs which have DHT receptors in their hair follicle. So this was the care after hair transplant. If you want to know more about it or if you have any question, you can ask in our comment section. If you like this information, please like the video and subscribe the channel. Thank you.